I think one of the hardest things about the state of where we are now in terms of visitation is that in the past, families were able to come in and sometimes, we spoke to them, we updated them, we gave them when important events happened, we called them. But a lot of times the communication was on the family to come in and see their loved one. That's changed since visitation has been blocked, and that now the responsibility and that driver of communication has been the doctors. And so we call almost every day. And it's funny, it's actually my favorite part of the day is calling these families and giving a brief update, even if it sounds the same as it had the last 3 or 4 or whatever days. And it's become kind of a source of joy, is calling and knowing their loved ones and having that relationship with them. So what I did very frequently is provide my personal contact, my cell phone, and just having my number, and every now and then feeling that if they really needed something, they could contact me, I think helped a lot. I mean, I try to think about if it were my family member getting admitted to a hospital, not hearing from any doctor, and then a month into it, them calling and saying, your wife's not gonna make it, and just being totally blown away from it by that. And so I think that breaking that barrier is really important in caring for these patients. In the cases where the patient, their loved one, wasn't going to make it, it seemed like it was a lot easier for the families and for me to share that information and to make the decision to let them go, just because of that relationship we had already built. I lost a patient a couple days ago, elderly man, coronavirus, and he was, the son had made the decision to take him off the ventilator and let him pass. And the daughter called and said, I just need him to know that we love him. So that I was able to do that for them. And being an intensivist, I think we all anticipate death. We anticipate people not doing well. And I think that a lot of us take pride and we have a lot of passion to helping families kind of cope with that and for people to die peacefully. I think that's really important to us. And I think, when COVID came, we saw a lot of that, and we are still seeing a lot of that. However, every now and then there's that patient who you didn't anticipate would make it, does make it, or miraculously gets better. And that's usually what drives us. I can't explain the way it makes you feel to see someone in their absolute worst and then have them fully recover. There's one patient I remember who was very close to us, and I said, we're gonna get you better. And I left, and the next day I came in and he had deteriorated, was put on a ventilator, and then was not doing well. He ended up going on ECMO that day, had a long, complicated course where he eventually got better, got off ECMO, started breathing normal air, and with his walker walked out of the hospital. And that's what it's all about. It wasn't me, it wasn't anyone particular, it was just the whole team.